Welcome to Educates on dengue fever or COVID-19, how to tell the difference. June is a rainy month, which means that mosquitoes are more active during this time. On typical days, these insects reside in areas that are moist, crowded, and have poor and inadequate sanitation. Stagnant waters are their favorite breeding grounds. Dengue is a serious illness and transmitted through the bite of a specific mosquito called Aedes aegypti or female Aedes albopictus. These mosquitoes are responsible for spreading other diseases, including yellow fever, chikungunya, and Zika virus. So when an infected mosquito bites a person with dengue virus, it can become a carrier of the virus. If the carrier mosquito bites someone else, the virus can enter the new host's body. After a few days, the person may begin to experience symptoms such as severe headache, vomiting, pain behind the eyes, muscle and joint pains, rash over most of the body, mild bleeding from the nose or gums, very high fever of 41 degrees Celsius. Prevention: clean your surroundings. Regularly drain and clean areas that are damp or have stagnant water like rain gutters, buckets, garbage cans, and pet bowls. Protect yourself by using mosquito net, screen for doors and windows, use of insect repellents. There is no specific treatment available for dengue, however, mild cases can be handled by drinking lots of fluids to prevent dehydration and get plenty of rest. Dengue fever versus COVID-19, can you tell them apart? COVID-19 and dengue fever are infectious diseases that share common symptoms. However, there are distinct differences between them that can help you differentiate between the two illnesses. Here's what you need to know to tell them apart. Similarities: both are infections caused by viruses. Both cause fever and body aches. Symptoms range from mild to severe. COVID-19 is spread through infected droplets while dengue fever is through mosquito bites. Common symptoms of COVID-19 is sore throat, chills, and difficulty of breathing, while dengue fever is headache, rash, and vomiting. Who is at risk with COVID-19? People traveling to or living in an area with uncontrolled community spread of the virus are at risk for COVID-19. Seniors and those with underlying medical conditions. People who travel to or live in tropical areas and those with previous dengue infections are at risk with dengue fever. Severe lung disease, heart problems, and blood clots are possible complications of COVID-19, while dengue fever complications are bleeding, reduced blood pressure, difficulty in breathing. If condition worsens due to complications, both may lead to death. Keep hands clean, avoid crowded places, wear a face mask, avoid touching your face, and social distancing are tips to protect yourself from COVID-19. To keep yourself safe from dengue fever, always use mosquito repellent, wear long-sleeved clothing, and remove containers with stagnant water. It is best to consult a doctor if you develop fever with any of the following: cough, diarrhea, loss of taste or smell, muscle or bone pains, nausea or vomiting, rash, shortness of breath. If you are experiencing any of these symptoms, seek medical attention immediately at your nearest clinic or hospitals for an accurate diagnosis and treatment options. Here are some common myths and facts about dengue fever and COVID-19. Myth: mosquitoes can spread COVID-19. Fact: mosquitoes are known to spread many types of diseases such as dengue and malaria, but not COVID-19. This new type of coronavirus is known to spread through droplets from saliva and nasal discharge, or when the person coughs and or sneezes. Myth: you can only catch dengue once in a lifetime. Fact: the dengue virus has 4 variants, which means that whenever you do get the infection, it might only grant you sufficient immunity to that particular strain, and makes you still susceptible to the other variants. A person can catch dengue up to 4 times during his or her lifetime. Myth: you cannot catch COVID-19 and dengue together. Fact: experts have highlighted that it could be possible for an individual to contract 2 different viral strains, that is COVID-19 along with dengue at the same time. This is what is known as a co-infection, and the reason why it's being advised to go for standard testing, no matter what similar or dissimilar symptoms you get. Myth: dengue is a mild infection, unlike COVID-19. Fact: while COVID-19 is a viral infection of severe magnitude, dengue fever can also be dangerous and cause complications if treatment is not taken in time. Just like many other infections, a dengue infection could be both mild or severe. Remember, it is essential to stay informed about the symptoms of dengue fever and COVID-19, to protect yourself and those around you. Keep yourself healthy and safe by practicing good hygiene, wearing protective gear, and following guidelines from health authorities. Let's all do our part to prevent the spread of these illnesses and stay healthy together.
Like and share this video. For more of You Meducates, follow us on Facebook. Thanks for watching.